If you are over 55, there is one thing I want you to remember today. Your body often whispers before it screams. A small change in your appetite, a little unexplained weight loss, a strange discomfort in your stomach or back, a tiredness that feels different from normal. Many seniors notice these changes and tell themselves, this is just part of getting older. But sometimes those changes are not simply aging. Sometimes they are signals from your body asking for attention. Pancreatic cancer is one of the most difficult cancers to recognize early because its warning signs can be subtle. They may look like everyday problems. They may come and go. They may be blamed on digestion, stress, medications, or getting older. And this is exactly why awareness matters. Today, we are going to discuss 8 symptoms of pancreatic cancer that seniors should never ignore. We will talk about why these symptoms are often missed, what changes inside the body may cause them, and when it is important to speak with a healthcare professional. By the end of this video, you will understand what your pancreas does, the warning signs that deserve attention, common mistakes people make when dismissing symptoms, and practical steps you can take to become more aware of your health. Hi everyone, I'm Dr. Sophia Adams, and welcome back to the channel. Here, we take the health concerns many older adults are told to simply live with, and we explain what may really be happening inside the body using clear medical information, simple explanations, and practical steps that can help you make better decisions about your health. Before we continue, I want to make something very clear. This video is not meant to create fear. Many symptoms we discuss today can happen because of many different conditions, and having one of these symptoms does not automatically mean you have pancreatic cancer. However, understanding your body and recognizing unusual changes can help you have important conversations with your doctor sooner. The pancreas is a small organ, but it has a very important job. It sits behind your stomach and plays a major role in digestion and blood sugar control. Your pancreas produces enzymes that help your body break down the food you eat. It also produces insulin, a hormone that helps control the amount of sugar in your blood. Think of your pancreas like a small control center working quietly in the background. You may not think about it every day, but your body depends on it. When problems develop in the pancreas, the signs are not always obvious. This is one reason pancreatic cancer can be challenging to detect early. According to the National Cancer Institute and the American Cancer Society, pancreatic cancer symptoms may not appear clearly until the disease has developed further. This is why recognizing unusual and persistent changes is so important. Now, let's discuss the warning signs. The first symptom seniors should never ignore is unexplained weight loss. Many older adults experience changes in weight as they age. Sometimes it happens because appetite changes, activity levels decrease, or eating habits are different. But there is a difference between intentional weight loss and unexplained weight loss. If you are losing weight without trying, especially if you have not changed your diet or exercise routine, it is something worth discussing with your healthcare provider. Pancreatic cancer can affect how your body digests food and uses nutrients. Because the pancreas helps produce digestive enzymes, problems with pancreatic function may affect how well your body absorbs important nutrients. You may notice that your clothes are becoming looser. You may notice that you are eating normally but still losing weight. You may feel weaker or less energetic than before. Many people ignore this because they think, I'm just getting older. But unexplained weight loss is your body telling you to pay closer attention. The second symptom is yellowing of the skin or eyes, also known as jaundice. This is one of the symptoms that should always be taken seriously. You may notice that the whites of your eyes look yellow. Your skin may appear yellow. Your urine may become darker. Your stools may become lighter in color. You may experience itching that seems unusual. The reason this can happen is because the pancreas is located close to the bile duct. The bile duct carries bile, a substance made by the liver that helps digest fats. If something blocks this pathway, bile can build up in the body and cause jaundice. Mayo Clinic identifies jaundice as one of the possible signs associated with pancreatic cancer, especially when the tumor affects certain areas of the pancreas. However, remember this, jaundice can happen for many reasons, including liver and gallbladder problems. The important message is not to panic. The important message is not to ignore it. The third symptom is persistent abdominal or back pain. Many seniors experience pain regularly. Back pain is common, muscle aches are common, joint discomfort is common. So it can be easy to dismiss pain as another part of aging. But pain that is new, unusual, persistent, or difficult to explain deserves attention. Some people with pancreatic cancer experience discomfort in the upper abdomen that may spread toward the back. Because the pancreas is located deep inside the body, the discomfort may not always feel like it is coming from the pancreas itself. You may think it is a back problem. You may think it is indigestion. You may think you simply slept in the wrong position. But when pain continues without a clear explanation, it is worth speaking with your doctor. The fourth symptom is changes in digestion. Your digestive system can tell you a lot about what is happening inside your body. Some people notice bloating, others notice changes in bowel habits. Some experience greasy stools that float, are difficult to flush, or have a stronger smell than usual. This can happen when the body is not properly breaking down and absorbing fats. Remember, your pancreas helps create enzymes that allow your body to digest food. When pancreatic function is affected, digestion may change. The American Cancer Society explains that digestive problems can occur with pancreatic cancer because the pancreas plays such an important role in digestion. Now, I want you to think about something. Have you noticed changes in your digestion that you simply accepted because you thought they were normal? Maybe you told yourself, this is just aging. This is just my stomach now. This happens to everyone. But your body's changes deserve attention. The fifth symptom is losing your appetite or feeling full very quickly. Have you ever sat down to eat and noticed that you do not have the same appetite you used to have? Maybe you eat a few bites and feel full. Maybe foods you once enjoyed no longer interest you. Maybe you are skipping meals without meaning to. Appetite changes can happen for many reasons: stress, medication side effects, dental problems, digestive conditions. Many things can affect how much we want to eat. But when appetite loss continues, especially when combined with weight loss, weakness, or digestive problems, it should not be ignored. Your appetite is one way your body communicates with you. The sixth symptom is new or worsening diabetes. Many people are surprised to learn that the pancreas and blood sugar control are closely connected. Your pancreas produces insulin, which helps your body use glucose for energy. When pancreatic function changes, blood sugar regulation can sometimes become more difficult. For some people, pancreatic cancer may be associated with the development of new diabetes later in life or sudden difficulty controlling existing diabetes. This does not mean every person who develops diabetes has pancreatic cancer. Most people do not. But if your blood sugar suddenly becomes difficult to manage, especially without an obvious reason, it is a conversation worth having with your healthcare provider. The seventh symptom is unusual tiredness and weakness. Everyone feels tired sometimes. A busy day can make you tired. Poor sleep can make you tired. Stress can make you tired. But there is a difference between normal tiredness and fatigue that feels unusual. Some people describe feeling exhausted even after resting. They may struggle with daily activities that used to feel easy. They may notice they do not have the same strength or energy they once had. Fatigue can happen with many health conditions, including infections, nutritional problems, medication effects, and chronic illnesses. But persistent, unexplained fatigue should not simply be blamed on aging. The eighth symptom is blood clots or unusual swelling. Some people with pancreatic cancer may have a higher risk of developing blood clots. A blood clot may cause swelling, pain, redness, or warmth, especially in one leg. However, many other conditions can cause similar symptoms. This is why medical evaluation is important. Your body's warning signs are not always obvious. Sometimes they appear as small changes that slowly become part of your normal routine. If this information has already helped you understand your body better, please take a moment to like this video. It helps this information reach more seniors who may be quietly experiencing changes but do not know what they mean. and I would love to hear from you. Have you ever experienced a health change that you ignored at first because you thought it was simply aging? Share your experience in the comments if you feel comfortable. Your story may encourage someone else to pay attention to their own health. Now, before I give you the practical steps, I need to say this clearly because your safety matters more than anything in this video. If you experience sudden severe abdominal pain, yellowing of the skin or eyes, unexplained rapid weight loss, vomiting that does not stop, blood in your stool, severe weakness, difficulty breathing, chest pain, or sudden swelling and pain in one leg, seek medical advice promptly. If symptoms are severe or life-threatening, seek emergency care. This video is for educational purposes only and does not replace personalized medical advice from your healthcare provider. Now let's talk about what you can do. First, do not ignore persistent changes. A symptom that lasts for a day may not always be serious, but a symptom that continues for weeks or keeps returning deserves attention. Second, keep a health record. Write down changes in your weight, your appetite, your digestion, your energy levels, your pain patterns, your blood sugar readings if you monitor them. This information can help your doctor see patterns that may otherwise be missed. Third, attend regular medical checkups. Many health conditions are easier to manage when they are identified early. Fourth, know your risk factors. Risk factors for pancreatic cancer can include older age, smoking history, family history, certain inherited conditions, and some long-term health conditions. Knowing your risk does not mean you should live in fear. It means you can make informed decisions. Fifth, speak up when something feels different. Many seniors hesitate because they do not want to bother their doctor. They think their concerns are too small. But your health is never a burden. Your questions matter. Your concerns matter. Your body matters. Many older adults feel worried when they notice changes. They may feel embarrassed. They may feel confused. They may wonder whether they are overreacting. But paying attention to your health is not weakness. It is wisdom. The goal is not to fear every symptom. The goal is to understand your body well enough to know when something deserves attention. What I want you to remember today is this: your body rarely changes for no reason. Pancreatic cancer symptoms can be subtle, but subtle does not mean unimportant. Unexplained weight loss, jaundice, persistent abdominal or back pain, digestive changes, loss of appetite, blood sugar changes, unusual fatigue, possible blood clot symptoms. These are changes worth discussing with a healthcare professional, especially when they continue or appear together. If this video helped you understand your health a little better today, please like this video and share it with someone who may benefit from this information. Tell me in the comments, which symptom surprised you the most? Subscribe to the channel and turn on notifications because every week, Dr. Sophia Adams breaks down important senior health topics in a simple, calm, and practical way. Remember, knowledge gives you power, and understanding your body is one of the best ways to protect your health and independence as you age.